DocTalk is brought to you by MERCK Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show. We're going to talk about metritis in cows with Dr. Nora Schrag. Dr. Schrag is a veterinarian here at Kansas State University who has years of veterinary practice. It's going to be a fun show. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning brought to you by Colostrix Colostrum Supplement and Replacer. Proven to provide essential immunity and help prevent scours from E. coli. Trust your newborn calf health to Colostrix from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. Dr. Dan here with Dr. Nora Schrag. She is a veterinarian here at Kansas State University and a good friend and a colleague. And today we're going to talk about retained placentas, metritis, different things to that nature because, man, I don't know how many, as a kid growing up, my dad and grandpa as veterinarians, I don't know how many times we were called to the farm to clean a cow.
Yep,
And
it happens, especially this time of year where we've got all these calves hitting, and it's an exciting time of year, but retained placentas can be really frustrating and can lead to what we call metritis, which is what we're going to talk about today.
Yep. So kind of talk to me about, let's just start out what normally happens after a cow gives birth and what is a normal happening.
So normal process of giving birth, there's all kinds of hormones that have to cascade and a bunch of different ones, and we're not going to get into all those, but normally they all have to happen at the right time and the right amount. So anytime we have something like a dystocia, or sometimes if the calf doesn't get up and suck later, we can have a disturbance in how those hormones are happening. So that's one thing that has to be absolutely right. And then as that calf is born, there's a bunch of fluid that comes out that should flush the uterus out. As long as we're not having to reach our hands in there for a dystocia, then that helps clean it. And then the other thing that really helps is once that calf gets up there to suck, when he starts nursing, that releases oxytocin, which is a really important hormone, and that contracts the uterus down, and that makes it smaller, and that decreases the time that that's open and available for bacteria to get in it. So.
Gotcha. So, I mean, obviously, things that cause metritis. What about the retained placentas? I mean,
so retained placenta. So normally,
why do they happen, or why do retained placentas?
Yeah. So normal process is the calf comes out, and then we expect that in at least, we usually say less than 12 hours, the placenta should come out, and that means it has to detach from where it's attached to the cow's uterus, right? And that detachment process depends on hormones to allow that separation. So if that happens normally, great, it falls out and the cow can clean up her uterus and there's nothing in there. If it doesn't fall out in time, then bacteria have a route to get in. It's sort of treated as foreign material in her uterus, and that's what sets up that really nasty smell that we're used to smelling when they're hanging out.
Gotcha. Well, we have just a minute to go. When you have that type of thing, it used to be we'd run to the farm and take them out. What's the thought process today.
So we can talk about treatment a little later, but I think really the important thing is we used to pull them out, and that detachment process needs to happen naturally. If we pull them, what happens is we end up leaving little pieces in there, and that can be worse.
Good. Well, it's good information, folks. An expert on the topic is with us today. We're going to come back with Dr. Nora Schrag here after these messages. Thanks for joining us on DocTalk today.
If my calves start healthy and stay healthy, I've got a good shot at making money. That is why I trust Clostrix. It gives my calves the protection they need until their own immune systems kick in.
Calf raisers trust Colostrix colostrum supplements. Colostrix is USDA licensed and proven effective. When your money is on the line, trust Colostrix.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thompson here with Dr. Nora Schrag. We're at Kansas State University's College of Veterinary Medicine, and we're talking about metritis, retained placentas, different things like that. And so we talked about normal, what's going to happen normally, spitting out the placenta, shrinking down, no infection, just move on. But there are times when we have things that are abnormal.
Absolutely. So let's start. The first abnormal thing we could have is that calf actually doesn't come out and we have to assist it, right? And so whenever that happens, the timing might be delayed, and that can mess up her natural hormone cascade. And also, if we have to reach in, then we're introducing possibly bacteria. And at the same time, if we have to manipulate a calf or move something, we're putting pressure on things. So not only do we have the chance to introduce bacteria, but then we might be bruising that tissue. So just in a dystocia, that normal process doesn't quite have a chance to do its thing, and we're at higher risk for bacteria entering and staying in the uterus.
Okay, so we should probably have a pretty good eye on these cows that we're going to pull calves in.
Yeah, I think that the risk is higher, so if you pull the calf, then that cow is one you want to watch. Make sure she actually gets rid of her placenta. If she doesn't, keep watching her. They're ones you want to make sure keep eating, for sure.
Okay, what are some other abnormal?
Yeah, so the other thing that we kind of talked about a little bit is if that calf doesn't get up there and nurse. So let's say we had a dystocia and it was a dead calf, then that cow never has a chance for the calf to nurse. That oxytocin never gets released and that uterus never shrinks down. So even if her placenta detaches, that uterus might stay bigger for longer, and that allows an opportunity for bacteria to get in.
Yeah, so should you go and strip that cow out? Or
Yeah, you can strip that cow out. You can also just
There's
inject.
a couple of them I don't really,
Yeah,
I think I'll just take my
sometimes,
chances.
especially if you don't have a really good spot to do it, instead of breaking your arm, you can also inject oxytocin. So that's not a bad thing to do, especially if it was maybe a tight pull, you can use oxytocin to contract that uterus when you think the cow's natural oxytocin might not be enough.
Oh, okay. So you can just give her some.
Sure, yeah. Absolutely, and that's one thing we can do. If you had a dystocia and you're watching the cow and you can tell that placenta is still hanging there, as long as you catch it early, so we say within the first 48 hours, oxytocin is a really good thing to give. That helps that uterus shrink down and should help kick out that placenta.
Cool. So hard pull. I was looking here to see if we had any other. Oh, placental detachment. We already talked about that a little bit, but I think it's important. We have about a minute to break. I think it's important for people to understand. Don't just go out there and grab a hold of that thing and pull it out, and because what you said.
And we maybe need to get some pictures, but the way that placenta is attached, I think, is what makes that really obvious, right? So there's all these little fingers that go together between
it's like
the
two
cow.
Velcro.
Yeah, between the cow and the placenta, and when we rip that out, it'll rip off right here and leave all those little fingers in there, and that is a perfect environment for bacteria, and that's what makes those infections so nasty. So, it is tempting, and that big old thing is hanging there, and it smells terrible. A little bit of light traction on it, but if it doesn't come just super easily, the other thing that helps is to tie it in a knot so she's not stepping on it, because sometimes the cow will actually pull on it herself, and we don't want that to happen either. So a lot of times we'll tie those up in a knot so the weight can pull on it slowly, but she's not stepping on it and yanking it up.
Perfect. We're going to take a break, folks. When we come back, we'll talk about clinical signs and treatment for metritis in cows. Hey folks, welcome to our Cattle First Minute, sponsored by Boehringer Ingelheim Vet Medica, and today we're going to talk about clostridial vaccines. And one of the things about clostridial vaccines is many times it's called, in layman's term, blackleg or something of that nature. But when you hear someone say, I'm going to give a 7-way blackleg, that is the vaccination for clostridials. Now, all of us that are watching this show are also vaccinated for a clostridial that's very common in our environment, called Clostridial tetani, and that is tetanus. So tetanus is a clostridial vaccine that humans and cattle alike receive. Make sure that we vaccinate our calves that are going to be housed on pastures that are high with the blackleg disease with a 7-way clostridial bactrin. We also want to make sure that we utilize that bactrin when they're going into a grow yard and again at the weaning process. When we want to use Clostridial tetani or tetanus vaccines is if you're going to use the technique of banding to castrate bull calves. Always use the tetanus toxoid. Clostridial vaccines have been around forever. They're one of the most effective vaccines that we have in the world, and they work really well.
You spent countless hours building a strong operation. But when it comes to trichomoniasis, the odds are stacked against you. It takes just one infected bull to take down the whole herd. Damage could include open cows, lost pregnancies, and lost profits. The good news is with TrichGuard, a herd doesn't have to feel like a house of cards.
Mark your calendars for Tuesday, March 26th in Beloit, where the first ever Stock Growers Field Day will be held by K-State Research and Extension, the Kansas Livestock Association, and the Kansas Bull Test. The event will be highlighted by a market outlook from Cattle Facts as well as a presentation from well-known reproductive physiologist Dr. Rick Funston, where he speaks about increasing production efficiency. From there, we'll also play host to over 30 ag-based businesses in the trade show and enjoy breakout sessions where producers can listen to speakers on topics that apply directly to their operation. This event should cater to producers of all size and scale and offer a social aspect as well, so we look forward to seeing you there for the inaugural Stock Growers Field Day in North Central Kansas.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Nora Schrag, and she's someone that is on the show quite often because of her knowledge, because of her personality, and because of her passion for veterinary medicine. I've known her for over a decade, and always pleased to work with her. Great veterinarian. I was telling her during the break that my granddad went out to clean a cow and the retained placenta, and he reached in there and he found a boot, and the guy had tied his bootlace to the placenta, and the cow had actually
Sucked it
sucked
right
it
back
right in and had the boot. So don't tie your boot.
Yeah, and that's actually a good topic. You know, we think about helping with dystocias, and some people, you know, it's maybe kind of an ego thing to not put gloves on, but it's actually more for the protection of the cow than it is for you, right? So gloves are a really good thing if you do dystocias, because we have natural bacteria on our hands. It's better to not expose the inside of the uterus to those bacteria.
Yeah, and these guys that think they're too expensive to get a glove, I just say, well, what if your local MD decided he was going to start saving on gloves? You'd make sure you got that 8 o'clock appointment.
That's right. Right. So let's talk about treatment.
Yep. Let's talk about treatment. What are we going to do to treat?
So I think the
Metritis?
first thing is the sooner we can notice that she has a retained placenta, then we can use oxytocin if it's in that first 48 hours. And I might also add, you should really work with your veterinarian. You know, there's a few area specifics, and they're going to have some good suggestions for your particular farm. So as we talk about this, we're really talking in general, but talk with your veterinarian. So in the first 48 hours, we can give oxytocin. It's a shot in the muscle that'll help that uterus contract down. If it's after that, then it doesn't do us much good. We can give all the oxytocin we want after 48 hours. It's really not going to have an effect because there's no place for that drug to go in the uterus. It just doesn't work. So it's a waste of money after that. But after that, then we can do a couple of things. So one would be very closely monitor that cow that she's eating. If the cow starts looking depressed, or she's kind of getting slower than everybody else, or not eating, then we want to think about taking her temperature, seeing if she needs some antibiotics. Because really, that's how we're going to treat this. If we get a true infection in there, antibiotics are our best choice to get rid of that infection.
So are we just going to give an injection of antibiotics? You know, we've heard all the tales of uterine infusions and
Sure. So for a long time, and I did this a lot growing up on a dairy, I would infuse cows, and we've kind of learned over the years that that's maybe not our best option. It can get rid of the infection, but a lot of those drugs that we use to infuse are pretty irritating. And so we might get rid of the infection quickly, but then that cow's time that it takes her to breed back is actually longer in the end. So usually we're treating these with systemic antibiotics.
Okay. And obviously the veterinarians will know bugs, pathogens.
Yep.
And you'll have to get a prescription for the antibiotics anyway.
Yeah.
So
and really it depends. So there is a little bit of difference in beef versus dairy, which antibiotic might make the most sense. So definitely talk to your veterinarian about that.
Absolutely. Well, folks, when we come back, we're going to do a wrap up with Dr. Nora Schrag. We're going to talk about outcomes of these cases and what you can expect if your cow has metritis.
My name is Dr. Cooper Williams, and I am a sports medicine specialist. I'm ICELP certified and certified within the Sports Medicine College as well. I just got finished teaching an ultrasound wet lab with a group here at ENSO Discoveries in Kansas. And it was a group of students that really had a lot of enthusiasm for learning new anatomy and really elucidating some of the structures that they're not comfortable with in their day-to-day practice. It's something that I really have a passion for doing, and I really love the scanning and basically how anatomy and clinical anatomy relates to how we approach treatment of horses, especially in regard to regenerative medicine. And ENSO Discoveries has specialized in both PRP and in stem cell research, and a lot of these regenerative techniques are used now to treat a variety of different structures in horses. And my job is to teach people the anatomy, the abnormal anatomy when we have damage, and basically how to ultrasound and how to be able to guide our treatments into these abnormal injuries, these structures that we need to be precise in how we approach treatment. And using these regenerative techniques, you can't just put them in wherever you want to. You have to direct these treatments exactly where an injury is so that they're going to work properly. And so that's what we were working on today in a variety of areas of the body: the neck, the back, the pelvic region, the distal limb, and reviewing how we look at these anatomical structures and determine if they're abnormal, and then how to go about treating these structures. And we actually did processing today and used some of these regenerative techniques today to help out a few of the patients that were part of the wet lab. We cannot be islands unto ourselves, and it's important for all of us to network. We all sort of learn little tricks and techniques. So I definitely would like to thank Enzo for the opportunity to be able to be here and interact with these students and to relay the information that I've gleaned over the years. And this is not the first time that I've been able to do this with Enzo. They've been very, very warm hosts and having us come out. And they obviously like to be able to put out this information and teach other veterinarians. And so their passion is my passion, and it's just being able to work together like this is fantastic.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Nora Schrag, and we are from Kansas State University. We're here to talk to you about metritis in cows, and we talked about the treatments. We've talked about what causes them. Now, what's going to happen to that cow?
Sure. So I think the most common thing that happens to these cows that have an infection is that it takes them longer to breed back. So if we're in a beef herd, then that's a cow that's not going to breed back in the first 60 days. Her calf is going to be smaller if she does breed back and you keep her. And in a dairy herd, it's going to take a lot more breedings to get her bred, and it's an inefficiency in either system, right? And so that's the most common thing that happens. Kind of the worst case scenario is if we don't notice that cow's a little off feed or she's feeling a little sick and we don't get her treated with antibiotics soon enough, she could end up dying. This can end up being a really severe infection.
Because some of these can go septic, right?
Right.
I mean,
so we've got a couple of things that the infection might stay within the uterus, and those cows are the ones that are slow to breed back, and eventually their natural immunity can a lot of times take care of that. But if that infection is so severe, it might move from the uterus into her bloodstream and into the whole cow. And those are cows that generally need some antibiotic to be able to survive that infection.
You bet. Well, I think that, when we're looking at, any kind of disease, would you say that the sooner we recognize it and the sooner we treat it, the better chance we have of recovery?
Absolutely. Well, and that's especially true with this, right? If we can treat it with oxytocin and get rid of that placenta, then our outcome is often a lot better. Sometimes we don't even have to move to an antibiotic, which is going to be more expensive.
And that's the reason why some of the dairies take the rectal temp of all the cows coming through the first 10 days of milk,
absolutely.
right?
And another thing I might bring up, we use anti-inflammatories frequently. So a common one would be Banamine.
Mm-hmm.
And we've noticed in dairy cows, we gave it to all of them thinking that, if we have a dystocia, then we might decrease that cow's pain and help her get back going faster. And we actually noticed that increased our metritis rate because the Banamine actually interferes with that detachment. So there's a lot of complicated things happening here. It's important to just remember anything we do, we need to be talking to our veterinarian and paying attention to what other effect that might have.
Yeah, well, it's all great information, and I'm very thankful that you would be on the show today. Folks, Dr. Nora Schrag, thanks for watching DocTalk, and remember, always work with your local veterinarian. If you want to know more about what we do here at DocTalk, you can find us on the web at www.doctalktv.com. Thanks for watching the show. I'm Dr. Dan Thompson here with Dr. Nora Schrag, and we'll see you down the road.
Closed captioning brought to you by Colostrix Colostrum Supplement and Replacer. Proven to provide essential immunity and help prevent scours from E. coli. Trust your newborn calf health to Colostrix from AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by MERCK Animal Health, the science of healthier animals.